Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
of inhalational anesthetics. First, systemic effects of inhalational anesthetics. First, respiratory system. In respiratory system, all inhalational anesthetics will inhibit the respiration. The work of breathing is increased by all inhalational anesthetics, and minimum increase in work of breathing is done by sevoflurane. Ciliary function. So all the inhalational anesthetics will inhibit the ciliary activity except the ether. On bronchial muscles, in normal person, the inhalational anesthetics will cause bronchodilation, and this bronchodilation is maximum done by sevoflurane, followed by halothane, followed by isoflurane, and desflurane will increase the airway resistance by around 10%. So the maximum bronchodilation is done by sevoflurane, followed by halothane, followed by isoflurane. Then in asthmaticus, the bronchodilation of sevoflurane is almost equal to the halothane. So if you were asked, inhalational agent of choice in asthmatics is sevoflurane, and maximum work of breathing is done by halothane, whereas minimum increase in work of breathing is by sevoflurane. Effect of inhalational anesthetics on cardiovascular system. On cardiovascular system, the inhalational anesthetics will decrease the cardiac output. Minimum decrease in cardiac output is seen in isoflurane. So these will preserve the baroreceptor reflex. Whereas hypotension, so these inhalational anesthetics also causes hypotension, and thus they will decrease the BP. Then in central nervous system, there is the effect of inhalational anesthetics on central nervous system. On central nervous system, they will decrease the cerebral metabolic rate, and also they will increase the cerebral blood flow, thus increasing the intracranial tension. Minimum increase in intracranial tension is seen in sevoflurane, and thus sevoflurane is the inhalational agent of choice for neurosurgery. Effect of inhalational anesthetic on eye. On eye, they decrease the intraocular pressure. Effect of inhalational anesthetic on liver. On liver, the inhalational anesthetics causes hepatotoxicity. Especially halothane causes maximum hepatotoxicity, whereas isoflurane and desflurane will also cause hepatotoxicity, but they are lesser. Hepatic blood flow, that is the total hepatic blood flow decreases, and maximum decrease in hepatic blood flow is by halothane, whereas minimum decrease in hepatic blood flow is seen in sevoflurane, and thus the sevoflurane is the ideal or inhalational agent of choice in hepatic patients is sevoflurane. Effect of inhalational agents on renal or kidney. So inhalational anesthetic agents will cause nephrotoxicity. So because of this nephrotoxicity, mainly because of the fluoride ion present in them. So renal threshold is around 50 micrometers. Overall, maximum fluoride is seen in methoxyflurane, so it causes more nephrotoxic. Maximum fluoride present in the inhalational anesthetic agent in current use is sevoflurane, but there is no fluoride is seen in desflurane, and as a result, because no fluorine is seen in desflurane, the inhalational anesthetic agent of choice for renal patients is desflurane. Then effect of inhalational anesthetic agents on uterus. On uterus, all are effective uterine relaxants. All inhalational anesthetics are effective uterine relaxants. Effect of inhalational anesthetic agents on muscular system. On muscular system, inhalational anesthetic agents are centrally acting muscle relaxants. So these inhalational anesthetic agents will decrease the requirement of muscle relaxants by around 30 to 40%. So currently, maximum relaxation of an inhalational anesthetic is done done by desflurane. Effect of inhalational anesthetic agent on anesthesia. Analgesia. On analgesia, currently, all the current use volatile agents have analgesia, have no have almost no analgesia. All volatile agents have almost no analgesia. They have no analgesia. Then amnesia. Amnesia is very good for inhalational anesthetic agent except nitrous oxide. So nitrous oxide is poorly amnestic.
So, summary of systemic effects of inhalational anesthetics. On respiratory system, the inhalational anesthetics will inhibit the respiration, work of breathing is increased, and minimum increase in work of breathing is with sevoflurane, whereas maximum increase in work of breathing is with halothane. These inhalational anesthetics will inhibit the ciliary activity except the ether. They are bronchodilators. So bronchodilation is maximum with sevoflurane followed by halothane followed by isoflurane. So desflurane will increase the airway resistance by 10%. In asthmaticus, the bronchodilation is equal in both sevoflurane and halothane. So inhalation agent of choice for asthmaticus is sevoflurane. In cardiovascular system, it decreases the cardiac output and also decreases the blood pressure. Minimum decrease in cardiac output is seen in isoflurane, and this isoflurane will preserve the baroreceptor reflex. CNS, it decreases the cerebral metabolic rate and decreases intracranial tension. Minimum increase in intracranial increases intracranial tension. Minimum increase in intracranial tension is seen in sevoflurane. So sevoflurane is inhalational agent of choice for neurosurgery. In the eye, it increases the intraocular pressure, whereas in the liver, it causes hepatotoxicity. Maximum hepatotoxic is halothane, followed by isoflurane and desflurane. Hepatic blood flow decreases, and this decrease in hepatic blood flow is maximum with halothane, and it is minimum for sevoflurane, and it is the investigation of choice for hepatic patients. In renal, nephrotoxicity is seen mainly because of fluorides, especially the renal threshold for fluorides is 50 micrometers. Maximum fluoride is seen in methoxyflurane and sevoflurane, whereas less is or absolutely no fluorine is seen in desflurane. So desflurane is inhalational anesthetic of choice for renal patients. In uterus, all are uterine muscle relaxants. In muscular system, they are centrally acting muscle relaxants. Thus, this will cause decreased muscle relaxation by 30 to 40%, and maximum muscle relaxation is seen in desflurane. Analgesia, they have no analgesia. They are very good amnestic agents except the nitrous oxide, which is a poor amnestic agent.
Thank you and thank you for watching.